This video will focus on the deep tendon reflexes of the upper and lower extremities as part of the basic neurological physical exam. Deep tendon reflexes involves using a reflex hammer to strike a tendon, causing a sudden stretch of the tendon. This sends an African signal to the spinal cord where there is a single synapse to a motor neuron, which then causes contraction of the muscle that the tendon is continuous with. We will be demonstrating the 5 major deep tendon reflexes, including the biceps, the brachioradials, the triceps, the patella and the Achilles reflexes.
First, I am going to discuss about the biceps reflex. For this reflex, the biceps tendon can be localized in the antecubital space. For this, the patient should flex their arm and I can feel the tendon itself pop up right in the area and push firmly the thumb of my hand over the tendon. I am using the small point of the reflex hammer to strike my own finger, and you should see flexion of the arm and contraction of the biceps muscle. Brachioradialis reflex. The brachioradialis reflex can also be elicited from this position. So the target to strike is the small end of the reflex hammer in a few inches proximal to the distal radius, just overlying the radius. If you have them extended their thumb, and you should feel the muscle in the tendon pop up and use a strike right over the radius, and you should see a slight flexion of the arm, often see as kind of a flicker of the thumb. Now the triceps reflex. The triceps tendon extended from the triceps and the posterior arm and then insert of the olecranon. So the best way to localize this is to just feel the proximal border of the olecranon on. When I extend the patient's arm, I can feel the triceps muscle and the tendon move there, localize the tendon and then use the small point of the hammer. When I strike, I see contraction of the triceps muscle as well as extension of the arm. So just proximal to the olecranon, I should see extension of the arm and contraction of the triceps. Now for the lower extremity, the patellar reflex. For the patellar reflex, the patellar tendon extends from the quadriceps muscle over the patella bone itself and insert on the proximal tibia to localize the tendon and the target for the reflex hammer. The bony border of the patella and then just inferior to this, you should feel the patellar tendon itself. And to make sure you are in the right spot, you ask the patient to extend his knee and you should feel this tendon pop up instance and you will be struck just distally to the inferior border of the patella. Use a small point of the reflex hammer to strike the tendon and you should see extension of the knee and contraction of the quadriceps muscle. Now the Achilles reflex. The Achilles tendon extends from the gastrocnemius and soleus muscle of the calf posterior over the ankle and inserts on the calcaneus of the heel bone to localize ten and the target for the reflex. You can feel the bony border of the calcaneus and just proximal to this, you should feel the tendon itself. And to make sure you are in the right spot, you can ask the patient to plantar flex his foot and you should feel this tendon move. So to actually elicit this reflex, you want to have the patient totally relax his leg and you apply slight dorsiflexion with your hand and then use the flat end of the hammer, the reflex hammer, and you strike the tendon.